Welcome everyone to today's session of the Link Center for GU Spotlight, Prostate Cancer and Sex, Navigating Intimacy for Men and Their Partners, led by Max McMahon. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the Link Center for this continued partnership. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit us at our website, www.dana-farber.org/resource center, or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to Max.
Thank you so much, Sierra. Delighted to be presenting today, and hopefully this is a helpful overview. Title is Prostate Cancer and Sex, Navigating Intimacy for Men and Their Partners. I am the primary social worker in the Lank Center for Genitourinary Oncology, and I work with men and their partners with prostate cancer. So I want to start by just a quick disclaimer, which is to say that what I cover today is not formal medical advice. It's intended to cover general themes and considerations for patients with prostate cancer. And this is going to be, again, an overview of some of the thematic areas and recommendations for men who are making treatment decisions and are curious about preserving their sexual health and intimacy. So I'll start just by noting that each patient has very different needs and concerns, but we know that at least 50% of men who have prostate cancer report that the sexual health side effects of treatment are a moderate or big problem. So that's a reported number. And it's fair to say that this is really a primary concern of many men and their spouses or partners when it comes to treatment decisions and outcomes of treatment. We know that up to 95% of men experience erectile dysfunction 1 year following surgery, and men will not produce ejaculate after having their prostate removed, and therefore will have a dry orgasm. So that's kind of one example of a very immediate effect of surgery, and certainly the erectile considerations are primary for men when they're making decisions about treatment options. We know that 70 to 90% of men on hormone or androgen deprivation therapy, known as ADT, experience a loss of libido, so loss of sexual interest, in addition to significant loss of their erections. Only a small portion of men experience pre-treatment potency, meaning their initial or original erectile strength and functioning, and a full return of libido after stopping androgen deprivation therapy. So again, most men who move forward with ADT are going to have significant impacts on their erections and loss of libido. We do know that penile rehab and erectile preservation during and after active treatment does have some positive effect for many men. And when we talk about penile rehab or erectile preservation, we're talking about maintaining blood flow and sensation through the use of Viagra Cialis, vacuum erection devices, and penile injections, which again, we're hoping can mitigate the effects of some of these treatments. One thing we neglect to talk about more generally is the real aspects of relational intimacy that can happen with treatment. So in other words, there can be tensions and conflicts and anxiety around sexual health issues that we don't deal with very directly in the exam rooms and provider conversations. And so the hope of this presentation really is to talk about ways that we can increase conversation around sexual health. So I want to cover now just some perspectives directly from men who talk about the impacts of treatment on their sense of themselves. Many men experience significant body image and relational dissatisfaction. So this can be a decrease in their feelings of self-worth with corresponding depression and perceptive thinking, which is basically worrying or intrusive thoughts. There's a sense for some men of a loss of masculine identity. They don't feel like they're themselves, the self that they knew. And that can be very profound. So they can feel very isolated in that feeling, and there can be avoidance of social situations. There can be avoidance of relational or normal activities in day-to-day life. And there can be numbing activities which happen as a result. So that can be drinking more alcohol, eating more, doing things to sort of avoid some of these more uncomfortable awareness or sense of self. And again, there also can be really significant impacts from androgen deprivation therapy, particularly on cognition and emotional well-being. Here are some quotes from men with prostate cancer. They've heard, "I'm a shell of myself. I feel prepubescent," and that can come with the loss of testosterone. "There's no interest in sex." That's, again, referring to loss of libido. "Not the man I used to be," and this sense of being effectively castrated. One way to think about prostate cancer treatment and sex and intimacy is this larger intimacy model. And the concept of sort of loss and grief that men experience destroyed intimacy with the diagnosis of prostate cancer, and then a fear that they're never going to be able to have sexual intimacy again. This can proceed to feeling like they need to go through the motion, so artificial intimacy, so having to pretend or fake interest or affection. Followed by a fear of failure, which can be avoiding intimacy altogether. And really what we hope to move towards is breaking down of barriers. So there's a constructing alternative intimacy or new intimacy for men and their partners once there's education and comfort in talking about some of the impacts of treatment and then the interventions to promote sexual health. So what do we hear from partners and spouses? Oftentimes, partners may not feel included or informed about sexual health risks and realities of treatment. So these consultations can often focus on patients and not on partners. And the more that partners can be involved in discussing treatment pathways and outcomes, the better. Partners may feel like it isn't their place to have feelings or speak about their own needs or concerns. So sometimes I'll hear people say, "Well, it's his cancer. It doesn't really matter what I think. I'm just here to support him." And certainly for relationships and intimacy, both perspectives and needs have to be considered. I find that many men misunderstand or don't know what their partner's needs may be. So there can sort of be this sense that of misunderstanding or not having alignment because there hasn't been a discussion about someone's concerns. So oftentimes men will say to me, "Well, we just don't talk about it. I don't really know what she's thinking," or there's assumptions about what a partner may be experiencing or thinking. So again, part of the role of this presentation today is in some ways normalize these experiences, but also encourage more communication. Both men and their partners can be afraid or avoidant of discussing sex and intimacy. And there is an importance of recognizing that discussion of sexuality, the loss in some ways and the other impacts, particularly for women who also may be going through their own changes with menopause, can bring up uncomfortable feelings that sometimes don't feel like they have an easy resolution. So we sometimes don't have quick ways of solving these issues. But again, the hope is that we can become more comfortable talking about these impacts. So some other quotes. "I worry my partner thinks I'm not attracted to her." I've heard a partner say of her husband, he might feel rejected or undesired. And I feel like I've let my wife down by not being intimate or not having interest in sex. So again, these can be common feelings that arise. So I want to talk a little bit about what's helpful in a medical environment and with providers. I encourage patients and family members, spouses, to really proactively speak with their providers about the impacts of treatment on sexual health and also the resources for maintaining sexual health and intimacy. So really including the medical oncologist and other specialists, which can include radiation oncology, surgeons, and nurses, to get really comprehensive perspectives on sexual health and the impacts of different treatment pathways on sexual health. And again, it's important to talk to different specialists because they will have different information for you. Informed decisions can then be made about treatment decisions, which balance the needs, the impacts of treatment on sexual health and the priorities around maintaining sexual health. Early education around what can be done to preserve libido and erectile function is important, and conversations around the use of Viagra and Cialis, which are PDE5 inhibitors, and other interventions such as penile injections, vacuum pumps, and implants, in addition to pelvic floor and physical therapy. These are interventions that it's helpful to have discussions early on to understand what's available to you. It is important to understand that there are realistic impacts of these treatments and that there is some level of change and loss that may occur. And what we hope is that there can be acceptance that things will feel different, but that there's also reasonable hope for reclaiming intimate relationships and pleasure. I want to talk for a moment about what's helpful for relationships and conversations. And one way we can think about intimacy is that people tend to have a sex script, which is the way they're used to engaging in a sexual activity. And sex scripts are something that happen over time in a relationship. And sex scripts have to change when there are new ways of functioning or changes in libido or interest. So being open to a change in a sex script, understanding that arousal may be different, initiation may be different. All of these things are really important in trying to maintain new forms of sexual intimacy. Focusing on foreplay and non-penetrative sex can alleviate anxiety and bring enjoyment. So just being able to touch, spend time together, not focus on genital stimulation necessarily. These are things that can help people feel more comfortable when there's anxiety. Spending quality time together and enjoying emotionally intimate activities helps couples connect. So really any kinds of activities that make people comfortable with one another. And again, that's very specific to each couple, but it could be a movie, it could be bowling, it could be taking a walk. Sometimes with the realities of everyday life, people can forget to spend time and enjoy each other's company. And really we encourage just enjoyment of one another, and that can often lead to more intimate activity. It's helpful to remember that there is a loss of spontaneous arousal. So this idea that men will just become aroused or have erections as they used to, often that's changed. Couples sometimes need to be more intentional about spending one-on-one time together with those bonding activities that I mentioned above. I mentioned the focus on non-genital touch, which is helpful for many couples. So being able to maintain intimacy with hugs and other types of sitting on the couch and being present with one another without a focus on genital stimulation or erotic stimulation. And again, that can help people feel more connected. It is important to understand your partner's needs, fears, and concerns around intimacy. Sometimes there's desire discrepancy, which essentially means that two people have a different level of interest in sex. And again, that's okay and that's normal, but these things have to be discussed. So one person may have more interest or there may be a lack of interest. But if these aren't discussed more openly with one another, then there can be confusion, there can be worry, there can be misinformation. And if these are things that are difficult to discuss together or certainly with a doctor, I always encourage finding a counselor who might create that space where some of these conversations can happen. We do know that acceptance, flexibility, and persistence as general frameworks and qualities is helpful for couples. So couples who are able to maintain connection and focus less on sexual outcomes and more on being flexible with one another and accepting new realities, we know that they have generally more satisfaction. For men who are single and trying to date or have an interest in dating, there's kind of unique considerations for them. Oftentimes there's a fear of rejection or sexual disappointment, and this can result in men avoiding meeting new romantic partners and avoiding dating. Really, by focusing on building trusting relationships and honest communication, men can find it easier to negotiate some of these questions and concerns and worries. And disclosure can be easier with a partner once there's real trust, but it is a reality that it's very difficult to talk about sexual health and intimacy, libido, and functioning in the bedroom when you're trying to meet someone new. And again, talking about this with a counselor, being able to talk with prospective partners about health concerns, that's all very important. But it is a significant barrier for many people. Gay men or men who have male partners and those who identify within the LGBTQIA plus community may have very specific concerns and needs that are not addressed particularly well. And we have a lot of indication that men who fall into this category feel like they're not understood or they're not listened to. And I really encourage people to be direct with their providers if they feel like they're not getting these needs addressed. And it is helpful to find supportive resources, groups, and communities to share these experiences and find positive interventions and ways of connecting. Included here is a list of resources that I encourage you to take a look at on your own. Dana-Farber does have a sexual health program where you can have a consultation with one of our psychologists around sexual health needs. There are some other links here to organizations that focus on sexual health and prostate cancer. I encourage you to look at these on your own and certainly, again, reach out to your providers to talk about some of these issues. I want to thank you so much for attending, and I hope this has been a helpful presentation today.
Thank you so much, Max, for that important and informative presentation today on navigating intimacy for men and their partners. This will be posted on the Blum YouTube playlist, as well as our Digital Resource Center. Please stay tuned for future spotlight sessions through the Blum. Thank you so much, Max, and we hope that you have a great day.